Welcome back to TMI with Terrell and Martha. We are so excited to be back with you. We hope that you will follow us on social media. We want you to be a part of how we build this program. But Terrell, we've got a very important guest today.
Yes, we do. So I want to welcome Jack Winter. He is Dr. Jack Winter, and he owns Winter Wellness here. He's a neighbor of the Spa on Green Street of mine, and we have started working together. Figuratively and literally, he's been working on me. I think I've seen him for about 19 sessions, and I'm feeling way better. Let's say tons better than I did when I came
That's a
in.
medical term, right?
Yeah, that's the medical
Yeah,
term.
right.
Because I'm just the patient at this point, and I'm
Yes.
feeling lots better than I did when I walked in. So, Jack, the reason why we wanted you to come is we wanted you to basically explain who you are,
Okay.
what you do, and what makes you different than other chiropractors, and how you go about creating health and optimal wellness for people.
Good. Sure, I'm a chiropractor and a kinesiologist. I went to chiropractic school and got licensed to be a chiropractor in the state of Georgia. But beyond that point, I started realizing that chiropractic, that was good for me. I had the realization that I wasn't solving a lot of deeper problems I saw people walk in with. So I did a process called kinesiology. Kinesiology is kind of a big word that means the study of movement. We do a thing called muscle testing. It helps us understand what's going on in your system specifically. So with muscle testing, we'll come in and find out any muscles that we find weak with you that will indicate to us something's going on in your system that's not in an empowerment.
Right, right.
So if we do that, we find a weakness. We try to determine where that weakness has come from. Is it a nutritional aspect? Is it an emotional aspect? Or is it a chemical, which is a nutritional aspect?
Well, Jack, I have found that he did pick up on a lot of things I had no idea about. I came in with specific concerns, and I discovered that you were able to pick up other concerns that were underlying those issues, which I would have never thought about. So, I feel like it's important that people understand how chiropractic care, acupressure, to be
Good understanding.
specific,
Exactly.
is what you do. It's fascinating, and if anybody is at least questioning what is that or how is it going to relate to me, you might want to think about finding someone in your area to be able to help you. If it's Dr. Winter, great, but Dr. Winter, expand on your background and some of the ways you go about assessing those
Sure. Let me
situations.
take you back to the beginning. Actually been in practice about 42 years, so I've learned a lot in that period of time. What I found out, first of all, I did a process called chiropractic, which works wonderfully well. Chiropractic deals with the nerve supply. If there's pressure on a nerve, wherever that nerve supply goes to will affect the body's function. So I had a lady that came in that couldn't use her arm very well. Adjusted a bone in her neck, her arm came back, and when the pain went away. She went home, came back the next day, same problem. Worked on her again, adjusted the bone structure, and the problem went away again. Then she came back a third day for the same problem. Okay, at this point, I'm becoming a Band-Aid. I don't want to be a Band-Aid. I want to solve a problem. So what I did with her is I took Gray's Anatomy and laid it on her back and found out which muscles will affect that bone structure. Actually balanced those muscles back out and adjusted her neck. Once we did that, nerve supply was clear, function came back, she went home. Then I didn't see her for about 2 weeks. So I called her up. I said, her name happened to be Martha. I said, Martha, how you doing? Oh, she said, oh, I'm fine. And by the way, that migraine headaches I've been having for all these years, after that muscle stuff, migraine headaches haven't come back since. I said, really? So I started having the realization that not only is nerve supply important, making sure the bone structure stays strong and keeps the nerve supply open 24/7. That started leading to more things. After that, I had the realization of a female with a period has cramping. Every 30 days, she has the same cramps. We think it's a back problem at the point. Oftentimes, it's not a back problem. It's a nerve supply. It's a nerve supply problem coming from an organ system. So if we could affect that organ change, we can actually affect that nerve function and affect the changes as well. So then I started looking at nutrition, see how that would affect us, and found out that helped a lot as well. Then this process called muscle testing, which is actually taking a strong muscle and looking for a weakness in the system. We use the muscle as an indicator, showing us there's something wrong in the system. What can we do to affect that change and get that muscle strong again? Is it a nerve supply problem? Is it a vitamin or mineral problem? Is it emotional mindset stress? So all the way along the way, over the years, I kept finding more and more things. Now it was nutrition. Now it was nerve supply. And we found emotional things affected people as well. I think many people out there know that as well. When you're stressed out, it affects your body. At those points in times, I can't walk very well. I didn't, earphones are coming off. That I can't walk very well, or I had gone to a medical doctor and he gave me some drug and medication. Now I felt better. So that was a chemical change in the system. So if we could work with nutrition and structural things and the emotional states, now we could affect change in the system, then more permanent. And that's where I
Wow.
want to go with people.
So, what do you think, Jack, is the biggest misconception? Because I think a lot of people think about uh, medical doctors and chiropractic doctors being separate,
Right.
right? And that one doesn't go with the other. But
Right.
I think there's a lot of data now to
Yeah.
kind of back up
Right.
that where one stops another, or they can work together and
Right.
things. So, what do you think is the biggest misconception about the business that you're in?
Well, that's a good question. What's difficult in our society, we are told, and we oftentimes go after symptoms. We have a symptom, we want the medical doctor to take the symptoms away, which is fine, and we all feel that way as well. However, oftentimes when you do that, you're not really getting the core of the problem, you're just taking care of that symptom. Our society, all the advertisements and all the information we're getting is about, I have this symptom, give me this and that will go away. And that's how we live our lives for the most part.
So I know you've got more thoughts on that, but this made me think about it. I remember when I was a very young woman in 1981, I was in one of the first HMOs. Okay. And the doctor I had was kind of an old school doctor, and he was actually Irish. So he had been educated somewhere else and then got his medicine here, his license here. And he was sharing with me, and he was very frustrated about the fact that all he was doing was treating the symptoms. This was back in 1981.
Good
He
doctor.
wasn't really getting to the bottom of what was causing
Good doctor.
people to be sick.
Right.
And yeah, he was my primary care doctor for a long period of time. But it was like the system, what's happened to American healthcare, and I know it's a bigger question than you can answer, but I'm sure you have thoughts on it,
Right.
is that we have gotten so bureaucratized
Right.
in American healthcare that we're not seeing where these spaces are that you
Right.
could fill in and make things better.
Right.
What
That's
do you
true.
think about that?
Well, Martha, that's absolutely true. And all the way along the way, again, our society has set it up that you have a problem, you go to your medical doctor. They set that up. So you're born in a hospital. I mean, from the beginning of the time you come in this world, you actually are told this is how you're going to do things, and you begin to run that pattern. If everybody said we were born at home, you would think differently. You would not do it quite the same way and think differently. And obviously, beyond that point, we always talk about this. If you have a pain or dysfunction, it's the body talking to you. I got this pain, deal with the pain. Don't cover it over. Identify why it's there and correct the problem. Or dysfunction. I can't walk properly. Why not? If the shoe's wrong, your hip's off, what's going on? So if we thought more that way, so okay, now I have this problem and I see it from the beginning. 20 years ago, 30 years ago, I saw the problem. Correct it right there. As it goes on in time, you're going to adapt from that problem. And that's when we see major down the road, major problems that we can't correct anymore.
And Martha, I have to say, the more the medical world and the holistic preventative care world, really, it's preventative care. I think the more they work together, the more we're going to find people achieving new heights of wellness because they're both necessary. And that was a very good question because there are spots between where they support each other. And it's been pretty magical being that this community is a huge medical community. And I have never wanted to interfere with the respect of this medical community. My child went to school with a large percentage of their children. So I was never trying to pit um, allopathic medicine against holistic healthcare in any way because they're both very, very necessary. So I think, Jack, you've probably done a pretty good job of putting that bridge there as well, because you can't provide care to a whole group of people who see doctors in this community and say anything negative against their doctors or what their doctor's advice is. You've got to take your doctor's advice, but you can also, as a sentient being, right, choose to research and look for all the options because you are your own health advocate, right? So you need to, research all options relative to
Well,
your
and I
health.
think we've also done such a disservice to people. Like we try with insurance to make things better, but all we've done is create a healthcare financing system instead of a healthcare
Yes,
system.
Correct.
absolutely.
And people make decisions on, will my insurance pay for this?
Oftentimes.
And if my insurance won't pay for this, I'm not going to do this.
Right.
And that's not always the best decision,
No.
and we always say our healthcare is invaluable. And it really is true. If you don't have your health, you don't have anything.
Right.
Right.
But we haven't secured that viewpoint in how the society deals with it. So I know I've gotten into a big subject there, but it's something I'm sure you deal with all the time because I'm sure people want to know, are you covered by insurance? How do I pay for this?
Right. Well, both of you ask a good question. When patients come into us, if somebody's in a lot of pain, right now, how are you going to get out of pain? Take ibuprofen and go there. Go take that warm shower, whatever medication you need to get through that process. Now, let's find out after that symptoms has burned itself down a little bit, how can now I go back and find out where did it come from? Especially if it's a reoccurring sinus infections. You all see this every spring,
Mm,
sinus
mm,
infections come up.
mm, mm, mm.
So they go back,
Me?
they take,
Yeah.
yeah. They take sinus medication. It's good for that period of time. Then the next year it comes back again. If we go back and solve why it happened in the first place, next year, most of my patients never come back with sinus infections because we got the cause of the problem. We don't want to discount the medical doctors. Obviously, people do love their doctors. They're not going to go to somebody else, but the doctors can tail together. And now we can solve the problem because the patients are why we're here. We're not here for us. We're here for the patients. Do the right thing for them.
Now, you've been successful in this community for a very long time, and I'm sure people come from far and wide, not just in this community, to be a part of this practice. Why do you think that happens, and what makes you different?
Well, it does have. We have a lot of people from all over the country, actually. Um, what the difference is, we've got to get results. I mean, that's the bottom line with everything. So if you have a problem you've had for a long period of time and you've done whatever you tried to have happen to solve your problem and you didn't solve it, you come in and get results, they're going to come back. What's nice about a process called muscle testing is actually every individual that walks in that building has their own unique problem. What is it? I don't know. You walk in, we'll find out what you have here. If your muscle's not strong in a certain area for your lungs, your gallbladder, your spleen, whatever, and we find a weakness in that area, we're going to target that area. Why is that happening? Nutrition, emotional wise, or structural wise. If you target that area and clear it, every visit we expect you to get off the table and say, I feel a difference. If you're doing that, we know we did our job well.
It's a pretty interesting process. I will tell you, I was pretty surprised. I jokingly called him my voodoo doctor, but I have found so many different things that I didn't realize were there. I can tell that those things are gone. There were some things I'd just grown to live with, so to speak, and
Oh, I think we all do that though.
Right.
yeah,
Right.
We all say, okay, so my mother and grandmother both had very serious arthritis issues. Okay, my grandmother really, really bad. I mean, I used to describe it that she sat down on life because she was in pain, so she made everything in her house at sitting level,
wow,
and just stopped doing anything that was difficult.
Right.
Okay. My mom very much just kind of stayed active, pushed through it, had that sort of can-do attitude about it, you know what I mean? But did have some mobility issues toward the end of her life, but she lived to be 88 and she lived independently her entire life. So it was good. But I see the same kinds of things in me. I've got arthritis in my neck and back and knees and everywhere it seems like. I kind of push through the pain. I'll be honest with you, because I don't want to take Advil 4 times a day.
Right.
I don't want to take pain pills. No, I don't
right,
want to, I don't want to start drinking too much, even though I would like to on some days. You know what I mean? But there is this attitude of, so I just keep moving.
Right.
I climb stairs, I do exercises, I do steps, all that sort of thing. But I'm very interested. Jack and I are going to start working together and we'll see how it goes. But I'm open because I think there's a better way than just pushing through the pain. You know
Right.
what I mean?
Great.
And that's what we do because we're taught to not complain.
That's right.
We're taught to not complain.
Right. Well, Martha, you're so right about this. What happens, it's interesting. Well, people will come in and say, what's your problem? What's your concern? Well, I have this knee problem. Okay. So I'll start talking to them. That's it. That's all I have. Then we'll start having the conversation. How are you sleeping? Well, I don't sleep, but I have a CPAP machine. How's your bowels? Well, I don't have bowel movements. Frequency, urgency. Oh, yeah, I'm frequency urgency. And you have a litany of things. We'll come up with 20 and sometimes up to 35 different symptoms they've lived with. And they got so used to it that they think that's the normal. It's like your mom. I mean, what else is she going to do? She's got the problem. They won't go away. So she just goes less and less in life is what happens.
Yeah, I mean, really, what I use a lot of times is I use heat and cold. a lot. That's my number one go-to
Right.
because I don't mind taking Advil at night so I'll sleep better,
Right.
but I don't want to start in the morning and take Advil every 4 or 6 hours, to keep my pain at bay because you don't want it to tear up your stomach. I mean, there's always, I care for my father-in-law who's in his 90s, and we're at this point where, you do something over here and it affects something over here, and you do something over here.
Right.
And what we want to do, I'm 65 years old, I don't mind saying so. I want to spend the next 30 years, which I think that's about what I've got, maybe, I hope.
Mobile.
I want to be mobile, I want to be there, and I want to be as comfortable as possible and live life the way I want to.
Right.
Not
Yeah.
necessarily, it could mean that I slow down. It might not mean that I slow down.
Right. Well, there's always a reason. We always talk about that. There's always a reason why you got the symptoms you have. What's the reason? We find the reason, solve the reasons. And sometimes people want to say, I want this one magic pill to all go away. It's not that way. It's not how it is.
We all want that.
We do.
There's
So-
no such thing.
No, there's no such thing. So what we're always talking about is that what are you willing to take responsibility for? What is that? Changing your diet, enjoying life, go out and play some golf. Whatever you do things in harmony and flow that allows your system to be healthy. That's really what it is. I'm with you. I hope another 20, 30 years that I'm anticipating as well.
Yeah.
Being healthy. Right?
Absolutely. That's
Right.
what you want. You want to be
Exactly.
able to move. You want to be able, and that's one of the things that I've seen is that I think chiropractors have a difficult time because people see you as a business more than a medical
Great
practice.
point.
And but I think there's been an evolution there because I've seen it with friends of mine and even in my own thinking. I'm married to a physician. He's a primary care physician. He's very much in the world of he likes chiropractors that understand where the limits are, where the line is, and where doctors need to get involved. And
Right.
and you're on that list, of people that he's known throughout the community that he knows are gonna know where that because there
He
are
can
times
respect that.
you've got to get
Yeah.
an MD involved sometimes.
Yeah.
Sometimes
Absolutely
it's
do.
not something. And I think where chiropractic, and you tell me if I'm wrong, had some issues in the past is that there were these kind of outlandish claims that were made.
Yes.
About fertility and maybe there is things you can do,
Right.
but it's almost as if they were trying to bring in people that had no other hope
Right.
and make promises they couldn't keep.
Murphy, you're right. We were taught that in chiropractic school. All I have to do is take the pressure off the nerve supply, everything will be fine. That's not reality. We all know that's not reality. So it's a help. And sometimes chiropractors see a success pattern. They did something, they got success with that. Well, I can do that with everybody. No, you did it with that one person. That doesn't mean everybody's in the same boat.
Because we're all different.
We are.
Yes, that's
Absolutely.
why it's called the practice.
That's right.
That's why
Right.
it's called a practice because you are not, every person's not the same. You have people that will fall into categories, right? And you have things like that, but everybody's different.
Correct.
Yeah.
Well, I think that's kind of the beauty of what we do here. You are different. You walk in, you're going to tell me your symptoms. We're going to work from those symptoms perspective. With you, it might be your diet's wrong. This person might be they're stressed out. Excuse me. So we're going to change that stress for them. So whatever it is, we have to deal with what's going on in front of them.
How big is the transition of how the digital world has impacted your practice? Not only in the small ways like how you keep records and all this kind of stuff, but in the bigger ways with problems that you're seeing
Right.
related to phones and computers and being on screens all the time. I
Good
would think that's
question. That's a
skyrocketing.
great question.
Yeah.
I bet.
It does. I think we know about cell phones next to the head. I think we know about that. We're living in a world of energy. Obviously, the internet, all this stuff's on us all the time. It's obviously affecting our system. We can actually measure that out. They've already got measurements. They already know that happens. That's the reality of the life we live now. This is how it is.
Yeah, it's not going to change. So you
Yeah.
got to figure out how to live with it.
Well, I
the-
bought a phone case that's got a EMF protector, so it's built in, and you can actually talk through the case if you want to talk on the phone. But really, for most people, they just use the speaker. Don't try to put it up against your head if you can get away with it.
Right.
We boomers use the speaker all the time.
We
okay?
do.
We do.
We do.
You can't hear 'em.
Sometimes
You're
when I
too-
shouldn't.
You're not a boomer, but Jack and I are.
But I'm right in there with you. I'm not a boomer, but I am. That's me at
Right.
100%.
Right.
In fact, my husband's always like, "Could you take it off speaker,
Right.
please?"
Yeah,
And I'm
everywhere
like,
you go.
Yeah.
It's funny. I was having some hearing issues because I've lived in a world where I've had headphones on my head for 30 years. And I went and I got all the tests and all that kind of stuff that goes along with it. And I tried the Apple Pro, not to make a commercial here, but Apple, if you
Right.
want to advertise with us, you can. But I tried, they have the hearing assist.
Right.
Mhm.
And it has just done the job. I mean, it was not that I wouldn't wear a hearing aid. I would if I needed
Right.
one, but it helps in the areas where I need help.
Right.
And it doesn't kind of separate me from the world. And it's worked great.
Right. Well, something to answer that question in a simple form, we always talk to people about this. Go back to simple things. What's your diet look like? Are you sleeping through the night? Are you angry with your husband or the dog next door? Correct the problem, you know? Yeah, really.
Yeah.
I know that.
The
So-
dog next door, not my husband.
Seriously.
Right.
Yes.
Don't
those
push your
darn
husband
dogs. Maybe donkeys.
Yeah, but if we take them back to basic things, that's where they have positions of power. They can make changes there. The internet, if they're going to use the internet, that's how it's going to happen. But work around that. So understand what your parameters are and what your empowerment is.
You know, it's funny because Lynn, my husband Lynn, is a primary care physician. He's a general internist. Okay, so he's an old school family doctor, and he loves solving problems. But he has often said that if people quit drinking, quit smoking, and ate right, he'd have nothing to do. Okay,
Yes.
I would agree with a lot of that. Isn't that true?
That's very wise.
Right.
That's right.
And it's funny. That's the hardest things for people not to do,
Well,
even
because
though
it's
it's the
a-
most
it's a-
detrimental.
It's a habit. You
It
know,
is a habit.
to your point about the person who started out with one problem and then you have 5 or 6 or 10, it's because they've adjusted
Right.
and then it's become a habit.
Right.
You know, and I've had both of my knees replaced and I had very good recovery with the first one. And Dr. DeCook, who did my knee, said, wait as long as you can for the second one because it never goes as well as the first one.
Right.
You know, and so I got the second one done. And I took a fall about 9 weeks into it, which has
I
kind of
remember that.
created some nerve issues and things like that. So I am still recovering from that second one, although I'm doing well. I don't have any pain, you know, any of that kind of stuff. But and I'm so much more mobile. And as we talked about in the last episode, I am like the poster child because I've lost weight. I'm in better health. I'm healthier than I was when I was 45
Right.
now. So I want to get even healthier than that, though. And so I think it's the balance because you do think you want to push through everything. I think isn't that the nature? I don't think it's just
Well,
Americans. I think it's people
I think it's
that want to survive.
human beings, and I think we tend to adapt to our dysfunction.
Right.
You know what I mean?
Yes.
And
You
so
guys
many
bring up a good point.
levels.
We have patterns. We run our lives in patterns. Whatever pattern you run, you keep running the same pattern, expect different results. I think they call it insanity.
Yeah.
So you got to begin to look at the pattern. Is that a good pattern for you or change the
Yeah.
pattern?
Are we
So-
insane?
So I want to ask you kind of a basic question. When somebody comes into your office, what is the first question that you ask them?
I asked them, do you realize your body is a self-healer? Nobody has ever said no yet. Your body is a self-healer. It's always, you cut yourself, it heals again. We all know that.
Right.
Does it work on the outside? Does it work on the inside? It does. It works both places. So if you have the understanding your body is a self-healer, why is it not healing? That's the next question. What is that? Now we're going to find out in front of us in the right time frame.
I would like to say as well that Jack does take insurance. So if someone wants to see him, right, that
Yes.
they can submit it, they can bring it in and turn in their insurance for that. Chiropractic is covered by a lot of insurance companies, and he's a chiropractor, so it's
And
possible.
You talked about it at the top of the show too about chiropractic and kinesiology. Can you
Right.
just kind of explain again the difference between that? Because people might have joined us late, and just
Sure.
so
Right.
that we can talk about that again.
Sure. Well, chiropractic is dealing with nerve supply. You have a spine. In your spine, you have 26 pairs of nerves come out from your spine. Those nerves go out in different organs and muscles and tissue. If there's pressure on one of those nerves, wherever that nerve supply goes to will affect that organ, muscle, or tissue. As chiropractors, what they do, they're looking for that bone structure out of position and put it back in position. And they do a thing called adjust. And adjust is pushing the body back in place. I stopped doing that about 30 some years ago because I heard a couple of people adjust and say, well, I don't need to be doing that anymore. So I started working with the muscles. If I get the muscle to pull the bone back in place and keep it in place, it would now maintain that function. So that's where I went to with that. So in my practice, I don't adjust or pop. I just work with the muscles and balance them out. So when I was looking at your symmetry and your balance, you should always be in symmetry and balance. If you are, the body can maintain that nerve supply function, and that's the next place to go from there.
That's so interesting.
Isn't it
that
great?
That's the transition that you made. That's
Yeah.
really good. You learned as you went.
Yes.
I mean, it's kind of like, again, you know, you have to take these board certifications every so
Yeah.
often. And he talks about, and I think you can relate to this, is that every time you take them, as you get into private practice, you learn what works with people, and it's farther and farther away from the book learning, we like to
Yes.
call. Do you know what I mean? You
Yes.
I
learn
want to
things
say,
as
I
you
want to say,
go.
amen to that because that's so true. Because when you see somebody in front of you, they told you that in school, but this person's in front of you, they don't care what you learned in school.
That's right.
You better solve the problem.
Right.
That's right. That's so
I will
funny.
say, from a personal trainer's perspective, I learned a lot of information back in the 90s as I started my career.
Oh, yeah, no pain, no gain.
That's right. That is so different than what we're dealing with now. And I'm not actively training individual people, but I am still a trainer, and I work on myself as a 59-year-old woman. And I have found that one of the things I fell into, which we will talk more as well, was thought field therapy. I had read a book by Dr. Roger Callahan about, people's strength mechanisms change if you clear their thought field, if you clear their mental constructs so that they can push more weight or do more activity. And I started applying thought field therapy to my practice, and people were like getting results over and over again. And then I went from there to reading a book by Pete Egoscue. He's got a book called Health Through Motion. This book is incredible. And there's Egoscue clinics all over the country. There's one in Atlanta. They can sponsor as well at some point if they would like to. But it was a wonderful bit of information because he was actually the one who treated Gerald Ford, right? Who we all know had many accidents
Mm-hmm.
and falls and had knee problems. So he was the one that brought him back to health. And he discovered the same thing you were talking about, that if you do not train the muscle to do what its job is, then it will pull the bone out of place over and over again. So his focus were the postural muscles of the body, and he came up with a protocol of, maybe 12 moves, 12 exercises, that if the person who had chronic pain if they did that regularly, it would take the pain away. And then their body would go back into postural balance. And I learned how to do assessments and see where people were out or rotated and improperly. And I got to see people get better. People who were living with chronic pain were getting better from just a little bit of time put into something daily. It had to be done daily, but it retaught those postural muscles what their job was and where it lived. And I thought that was fabulous. So that's basically what you do,
Right.
but he does it very quickly. It's like he circumvents all that and he can get it done in 15 minutes.
So, how important is it the in between time? So, I'm sure you're going to see someone, then you're going to recommend you know, a schedule of care.
Right.
I'm not sure what you call it, but something
Right.
like that, a
Right.
schedule of care. But what's do you need to do in between time?
Good question. So all the way along the way, it's what are they going to do? What are they willing to do? Some people say, "Gosh, I'd like to change my diet, but my husband does all the cooking at the house." Okay, so can you have maybe go to the store and buy things for cooking so he can change that? Our biggest job, and Tara knows this as well, is teaching people, educating people about good health. That's our biggest job. If they understood the right thing to do, they would not be sick in the first place. But our society has so many things that pushed on top of them that they don't eat well. They're stressed out. Their physical function isn't well. So teaching them to go back to things, if we talk about basic things again, the basics are where we need to go back to.
So, one of the things we'll be talking about every so many episodes is looking at what the government's doing related
Yes.
to healthcare. Robert Kennedy as the HHS secretary, but he's opened the eyes, I think, of a lot of
Absolutely.
people related to things like additives.
Yeah.
You may agree or disagree with him on a whole range of things, okay? But for me personally, was the opening my eyes on these additives.
Right.
And just this week, they've taken titanium something out of Skittles because they were putting them in Skittles to make them shiny and the colors bright. And they had already taken them out of the ones that were in Europe.
Yeah.
Okay, but they were still using them in the one. And so I went to see my grandkids last weekend. And so when we got there, we went straight to the ballpark, and my grandson had a pack of Skittles, of course,
Right.
because kids love Skittles. And, that's important, isn't it?
Right.
The understanding the additives and really knowing, I can't believe they put coloring in pickles.
Yeah.
They put things, I get
It's
sometimes
insidious.
adding coloring for whatever, but on things like fresh vegetables that you shouldn't have to add color, why are they
Right.
doing that?
right. Well, obviously, it looks good. It tastes
Yeah.
good, and that's what it is.
Marketing.
Like to also go back to mindset. I'm sure you realize in the 50s, you know, I've been around a long time. In the 50s and 60s, where people did not have a weight problem. Look what's happened the last 40, 50, 60 years. Overweight, obesity is more the
Yeah.
norm than the abnorm. Where'd that come from? Genetically modified wheat is actually where it came from. So people begin to understand that they thought it was fat, they thought it was eggs, they thought it was beef, whatever they thought it was. It's our wheat. European wheat we can do fine with, not American wheat. Just a very basic thing. And we try to get our people off wheat, corn, and dairy and sugar as quick as we can.
You know, it's so funny when my husband and
It's
I
a
like
lot.
to take vacations in the UK and in other places where it's cooler in the summer. And the food is fantastic.
Isn't it though?
Mhm.
And I don't gain weight on vacation.
No.
It's crazy.
Why?
It's crazy because
I
you
lost
always think you're
weight
going to gain weight. I did too
out of the
because you're
country.
walking, you're moving, you're out of the
Mhm.
country. Even the
Right.
wine and the things like that are better than they were.
Also, by the way, when what they do in Europe, just like you are as well. You can eat anything you want over there. It's always interesting to me when they sit down and have a dinner. They have a dinner for 2 or 3 or 4 hours. And Americans, they're doing the drive-throughs.
Well, we're in a hurry.
That's right.
We're
We
always
are.
in a
We
hurry.
are
Right.
in a hurry.
Right. Right.
I mean, I found myself today in a time constraint. You know, we're always rushing, and that's part of the problem too. We're not even digesting the foods
Right.
properly that we do eat because, you know, standing up, eating, just shoving stuff in the mouth, not mindful or appreciative even. You know, gone are the days of sitting around the table and saying grace, talking about your day, eating. You know, those are some really carefree things we used to do, and we just don't have that
And
anymore
think
in
about
our
back
day
to
and
basics
age.
back then too. Remember we sat down with mom and dad and we had dinner together at a
Yeah,
certain time every day, every night. We talked to each other back and forth. What's going on in your school? How's life going? We don't have those times anymore.
no.
We've lost that. There's the emotional aspect we're missing in our lives as well.
Yeah, I mean, I remember I did an interview recently where I had to talk about my childhood, and I said, "Yeah, we sat down at the table every night, and my dad asked us about current events, and we talked about things, and we tried to do that as much as we could with our kids. We had dinner every night, but my husband's schedule sometimes he didn't get home for dinner, or
Right.
whatever. But we still tried to sit down and have dinner. But by the time they were in high school, that was kind of gone. And I do think we need to work on that and take the time. People say you can't go back, but I don't believe that. I think you can go back.
You can. But
Well,
there's a desire to
I
do
think
whatever
you
you
have
want
to
to. Yeah.
find ways to make it work with your lifestyle. I raised my children almost alone. Their father, we were married over 10 years. He toured. He was a country music artist. So I was at home. I was working full time and having to do my best with the kiddos. But one of the things that I realize now, and I had this conversation this morning with my daughter and son-in-law. I said, and they care about her diet, my granddaughter's diet. They care about what she's eating. He's always researching probiotics and homemade yogurts. But I told them both, if you don't take care of her mental health and her emotional well being, you might as well feed her Twinkies and Skittles all day long, right? Because the true root cause for a lot of dysfunction in the body is a lot of the childhood trauma or the feelings and emotions that can't get digested because they're more than a child can manage or anything of that nature. Those things matter. And so
How
when
about
I
the
told them that, I think they were just
yeah?
shocked.
How
Like,
about the emotional eating that people do?
yeah,
People
yeah.
overweight. That's one of the major problems they have. They're stressed
Mhm.
out and they can eat. They feel better for a short period of time. Emotional
So,
eating.
I think we'll get to that in one of our episodes as well. We've got someone who's a professional with trauma resolution, and she's wanting to come on board and talk about breath work and sound baths
Well,
and all
and
that stuff.
and
But
parenting is really important, and I
yeah,
think that a lot of kids don't get that ability to learn on their own
right.
anymore. Everything is so catered to,
Hmm.
and parents don't want it. I mean, I used to throw my kids out in the morning in the summer, and I would lock all the doors except for the door to the mudroom and the half bath until lunchtime, so that they
Right.
would play outside until lunchtime. And that meant a pickup baseball game in a field where they had to negotiate the rules themselves.
Yes.
Okay, where they had to get rid of the squabbles themselves,
Mhm.
and we don't do that as much anymore. And I know it's a sign of age when you start talking about the good old days, but I think it's important that kids have that kind of independence
Okay.
because if they grow up active, I think you're going to see less of them. That's not good for you, but you'll
That's
be
fine.
retired by
That's
then.
fine.
You'll see less of them as they grow up because if they grow up active.
Well, that's one, one more question to kind of tie us up here was, do you see children in your practice here, you and your wife? Tell me a little bit about how you care for the
And
children.
how you can interact.
Yeah.
We've had them at 2 weeks old come in.
Wow.
So we do a thing called surrogate testing. That's a muscle testing. We actually use a parent to actually touch the child. You start finding out what the weaknesses are. And as you muscle test and find weaknesses, we do a thing called acupressure, which is acupuncture. You clear acupressure points. And when you do that, you can see the changes in the children right away.
Wow.
A little
That's
baby that couldn't latch. Have you ever heard the word latching?
Yes,
Mhm.
yes.
Yeah.
Couldn't latch.
Breastfeeding.
Right. So they want to
Mhm.
do a surgical procedure on the lip, actually, is what happened. So we came, we had a chance to work on her that day. When we got done, she started latched when she got up off the table. Let us do a video for me. We got probably 120 videos of those kinds of things. So I know this seems unbelievable.
And so
to
that's
do.
the natural next question. How can people find out more about you?
Well, thank you for asking that. The Winter Wellness Center in Gainesville, Georgia. We're on Green Street. They go to the Winter Wellness Center or make a phone call or do our website. Or they make a phone.
Absolutely. Well, listen, we're going to have you back because I think there's a
Absolutely.
lot more to talk about.
Yeah. Oh, boy. We could have kept going, couldn't we?
Yes, and we want people to follow us on social media. We want people to be a part of what we're doing. I think it's really important that we hear from you as far as what you want us to talk about. We want you to like and subscribe if you're liking us on YouTube, if you're watching us on YouTube, but you can get us also on all the podcast platforms. So we hope you'll be a part of that. And if you want to know what we're talking about next week, you can go to our social media and you can find out the things we're doing.
Thank you, Martha. And, one of the things I like to make sure everybody remembers is that your wellness deserves a little oversharing.
We're glad you joined us today on TMI with Terrell and Martha.